Welcome to longevitypost.com, and with me as always is Brian. Hi, Brian.
Hello there, Bob. So today we're going to be discussing how to conquer or eliminate or destroy your drug addiction.
And specifically, Brian, what kind of drug addictions are we talking about here?
Really all of them. So for example, Bob, there is the prescription variety and there's also the street variety.
Yeah, exactly, Brian. And if we begin talking about addictions due to prescription drugs.
Yeah, so you have the opiates, for example. You've got the serotonin reuptake inhibitors. You've got a variety of different types of prescription medication that seems to be successfully converting patients into customers for life. But then there's the other side, Bob, where you have the street drugs. So this addiction goes far and wide. It goes everything from alcoholism to the opiates, the pain pills, obviously, some of the depressive or anxiety-like drugs that are very addictive as well. So these can all be conquered, and we have a step-by-step procedure on how to do this, Bob.
Would you suggest the same kind of treatment plan for both the pharmaceutical drugs and the street drugs?
It largely can be similar, Bob. There are some differences that we should clarify because the drugs in question usually have a slightly different attribute to them. But I think in general, the mechanisms are similar, and we'll leave it at that for now to keep it simple.
So if you're addicted to heroin, how would you tackle this? What is your approach?
What exactly is the hook? What is the mechanism that happens when you start to withdraw? As we all are aware, people go through sort of a detoxification reaction. What it does is it releases the fat store of those chemicals into the bloodstream, and that creates a form of oxidative stress. This can create a detoxification reaction. This can be very uncomfortable, and of course the only way to stop this is to go back onto the drug. It's a very horrific feeling to be going through this sort of detox. But what if there are a way, Bob, which I will be discussing, of how you can go through this detoxification process without the raging cravings or without the very uncomfortable effects that occur. So this is a huge step on how to actually recover from the addiction that holds people prisoner. If that makes any sense.
Well, it makes sense, and I'm eager to find out what you are suggesting here. One question I have for you is, when you are addicted, the body is actually encapsulating these poisons into fat, right?
Yes, so of course fat is a storage depot for many toxins, whether it's from drugs or the environment. And so when we are oxidating the fat away, in turn that is releasing into the bloodstream, which makes the addictive process so difficult because you're sort of getting a taste of what you're missing, and your body says, I want more of this. Otherwise, the detoxification effects continue, and you just start to feel awful.
So, Brian, tell me more about step one. What is the first line of defense here?
Okay, so the very first way to start this process is you want to take a load, and I do mean a load, a megadose, a heroic dose of vitamin C. So, for example, it's not uncommon to administer anywhere from 20 to 100 grams of vitamin C per day to a drug addict. Now, you might be wondering, how is this actually done? One is you could go to a clinic that administers a vitamin C drip, which could give you that 20 to 100 grams daily infusion. Or you can do it in your own home, which I think is easier. You can buy a packet of a type of lipospheric vitamin C, which means you can deliver it through oral route, and it'll be a very high level. The lipospheric C is normally encoded in such a way so it's not broken down in the gastrointestinal tract. Most of it can actually work into the bloodstream, allowing you to use lower doses and achieve a similar effect that the higher doses of intravenous delivery normally would allow. And then the other way is basically just plain regular vitamin C, but you'd have to take up to bowel tolerance every day. So let me clarify one little thing, is that you want to continue the high doses of vitamin C at least 4 to 6 days on those very, very high dosage levels. And then it can be lowered to a maintenance dose, whatever that maintenance dose happens to be. So you want to maintain levels of vitamin C in your system, I would say at least a month, and preferably 2 months, to really get this thing under control.
So you're basically taking this several times a day.
Well, to be more clear, is what bowel tolerance means is once you get to the level where your body can only hold so much, the sicker you are, the more oxidative stress that you are experiencing due to detoxification reaction, the higher level of vitamin C your body can actually handle without having what's called an ascorbic acid flush, or basically losing vitamin C through the bowels. So this is what's called bowel tolerance, is having a high level of vitamin C just before the stools become loose. So when you're sick or going through an acute detoxification reaction, you can hold a very high level of vitamin C orally. So, you may start off with 5 grams, 10 grams to work your way up. If it's lipospheric C, you could probably take several grams per day in a packet that contains a lipospheric or a phospholipid-based vitamin C.
So what would be the second step?
The second step, Bob, is you'd want to look into some additional companion nutrients. Now, for certain people, this is really where you have maybe a mood imbalance, for example. So a mineral, and this is a natural type of mineral, not to be confused with the drug, because most people know this as a drug, but it's really a mineral. It's called orotate of lithium, or lithium orotate. Not to be confused with lithium carbonate, but it is the lithium mineral. And the major difference here is that it's bound to a type of transporter that allows it to be shuttled in the body more effectively at very lower doses. And the idea here is to stabilize the cell membrane and prevent some of the free radical occurrence in the brain, and that it does help manage a specific type of reaction that creates sort of a frontal lobe free radical explosion. So what this really does is it counteracts what's called glutamate toxicity, which is a very common occurrence in drug addiction. And so the lithium is going to placate a certain reaction that is undesirable. Therefore, to sort of stabilize your mood so you're not going to be raging, whether it's the bottle of alcohol or the opiates or whatever it might be.
Okay, Brian, very interesting information. Step 1 is vitamin C. Step 2 is lithium orotate. What would step 3 be?
Okay, so after those first initial steps, Bob, a very, very critical piece of this puzzle, I cannot really emphasize how important, is you want to introduce a wonderful therapy known as infrared sauna. You can also use near infrared as well. So, drug residues, as I said earlier, Bob, they're stored in fat, and they are a factor in persistent symptoms of addiction. So when you're using an infrared sauna or a near infrared, what you're really doing, Bob, is you're sweating out these drug metabolites. And if left unchecked, they will stimulate future addiction, because as you oxidize or burn fat, these chemicals, once released into the bloodstream, are going to create those cravings again, that sensation. That's exactly what you want to avoid. So when you're going through detoxification, such as the vitamin C and using the lithium, you want to also follow this up 30 minutes a day of using a near or infrared sauna. And you want to do this for at least 30 days, preferably even longer, because what this is going to do is it's going to ensure that you're getting plenty of the drug metabolites out of your system, out of your fat. So therefore, you're going to be less likely to go into a relapse.
Is it important to take supportive supplements here when you're sweating out a lot of things?
That's a great question, Bob, and the answer is a resounding yes. What you really want to do is you want to replace the salts you are losing with some sort of electrolytes, preferably a good quality type of salt, whether it's Himalayan salt or sea salt or Celtic salt. My preference here is what's called 40,000 volts, which is a negatively charged blend of sodium chloride, magnesium, and potassium, and there's trace levels of lithium in there as well. Very, very vital to have the sodium chloride or a salt that has a charge, because what you're doing here is salt is a wonderful way of eradicating toxins, but it's also the primary mineral that you're losing when you're sweating. You really, really want to do this because it's going to allow a more healthy type of detoxification. So the next most important thing here, Bob, is the mineral magnesium. So consider that In 2003, there was a study showing a group of 12 addicts, and they were given magnesium or placebo. And the urine samples that were looked at twice a week for 12 weeks, those taking magnesium had drugs in their urine only 16% of the time versus the placebo group where they had drugs in their urine 48% of the time. Now, why would that work? Well, magnesium does reduce glutamate toxicity, and I mentioned that a little bit earlier in a discussion about lithium orotate. So magnesium is a wonderful substance. It does reduce anxiety, it does produce a level of calm, and it does shut off glutamate receptor. And that is the very type of receptor that causes raging alcoholic. It creates the type of belligerent behavior in drug addiction. So you definitely want to improve magnesium. Magnesium is also something that when you have enough in your body is going to help produce a higher level of electron health. It's great for your mitochondria. It's good for your health and your exterior also.
So Brian, what comes after magnesium?
So after that, you might consider what's called amino acid therapy. Now, what are amino acids? Well, things that comprise of protein. So, for example, in battling drug addiction, to improve your overall rate of success, there are certain individual amino acids, such as L-glutamine, that have been demonstrated to help addiction or reduce addiction. There's also a broader level of amino acids that have been shown to be even more protective against drug addiction. So amino acids are converted into neurotransmitters, and they help repair damage to the brain. Now, as you can only imagine, Bob, years and years and years of drug addiction really just decimates amino acids, which are necessary to repair the brain. What happens to these proteins in the diet? Well, proteins are broken down into individual amino acids, but they're often sacrificed as antioxidants due to the very high oxidative stress that's occurring. So in order to actually facilitate repair, you need nutrients, cofactors, and amino acids to help produce the healthy levels of neurotransmitters that were once sacrificed to basically deal with the constant attack of the body. So kind of an oversimplification. So a chronic drug addict is going to need to repair their neuroreceptors because this creates a cycle of dependency when you have a problem with the neuroreceptor. So in place of the drugs, targeted amino acids can facilitate repair and also satisfy the craving. So you're really repairing the actual cycle of addiction itself. Does that make sense?
Yeah, it makes complete sense. And the only thing I'm wondering now is how should one with addiction think about diet?
So in a word, I suppose you can say two words, quality protein is really what should be a big factor in your diet. Why would this be? Well, those with addictive behaviors, when they typically consume a lot of refined commercial foods, packaged foods, junk foods, if you will, turns out that when a drug addict, you can imagine they want to have all the money for their drugs or whatever it is, they're going to be loading up at their local convenience mart that has low-priced convenience foods, ready-to-eat foods that are at minimal cost. The problem with these foods is they actually fuel addiction because they are largely, they convert a lot of foods into insulin, or they're high glycemic foods. These are the types of foods that create a brain behavior which stimulate what's called the glutamate receptor activity. This is the very type of food that fuels addiction. On the other hand, quality protein reduces an access. I won't get too much into details, but what it does is it gives material very much like the amino acids, fuel for repair, rather than creating a sense of need for more of the drug. So you're really facilitating repair and going away from the negative reaction that creates a glutamate receptor problem. Glutamate receptors are the things in the brain that can activate hormones that do affect not just addictive behavior, but the oxidative stress reaction in the brain.
Are there any other supplements you would like to mention?
So to answer your question, Bob, what else can you take supplemental-wise? There is anything that contains a form of organic sulfur. It appears to have a synergistic and positive effect on anything related to metabolism. For addiction, sulfur compounds, they improve cellular detoxification. So any ability for your body to get rid of any offenders, detoxifying from the cell is sort of an initial step that needs to happen to ensure that you're getting the happy neurotransmitters and you're also curtailing the cravings. So forms of sulfur really are a marvelous types of food to really keep you away from the addictive tendencies. And it also helps encourage your liver to help recover as well. So examples of sulfur compounds are things like lipoic acid, N-acetylcysteine, known as NAC for short, sulforaphane, methylsulfonamethane, otherwise known as MSM. So those are forms of sulfur. Let's get into what you could avoid. So what's harmful to the brain, whether people are really aware of it or not, if you're still drinking diet products, things that contain aspartame or NutraSweet or Amino Sweet, all essentially the same thing, or if you're consuming other dietary artificial sweeteners, these stimulate glutamate toxicity, the very thing that fuels addictive behavior. Part of why it fuels addictive behavior is that it interrupts the reasoning center of the brain. And so you're more likely to do things you might regret.